Hello and welcome to today's episode of Dr. Simone's Mindspace. Today I'm going to talk to you about our optimal performance monthly theme, and topic of this month of October is PCOS. PCOS stands for Polycystic ovary syndrome, a hormone imbalance that causes infertility, obesity, and excessive facial hair in women. Can also lead to severe mental health issues, including anxiety, depression, and eating disorder. A study supervised by a colleague of mine from Columbia University School of Nursing, Professor Nancy Reame, and published in the Journal of Behavioral Health Services and Research, identifies that PCOS complications that may be most responsible for psychiatric problems. While weight gain and unwanted body hair can be distressing, and irregular menstrual cycles an issue, is the symptoms of PCOS most strongly associated with psychiatric problems, the study found. And this is also why I thought it's very important to stress a interdisciplinary approach to so many of all the disorders and disease we see in today's world, and PCOS being one of them that you can treat from a multidisciplinary approach, such as we have at Optimal Performance, where we have a physiotherapist, myself as a psychologist, and also our colleague who is an expert in alternative medicine and works with hormone imbalances. So we do really have a cover for all the aspects of women's health, and we are 3 women as well. Menstrual abnormalities in women with PCOS was the strongest predictor for mental health issues, particularly when there are so many other symptoms like beard growth and infertility that can make a woman feel unfeminine. And I think this is a very important aspect to consider, this lack of feeling feminine, and one that definitely can be treated in psychotherapy. Women with PCOS had a significantly higher level of psychological distress than the general population of women. For more than half of those disorders, the women with PCOS had levels statistically similar to those of females with psychiatric patients. Reame et al. 2014 from Columbia found that when comparing participants with women in the general population, PCOS women had significantly higher scores on all of the symptoms evaluated and on corresponding psychological distress measures, particularly for anxiety and depression, somatization, the conversion of psychological distress to physical symptoms, and interpersonal sensitivity. So it is really an important aspect to treat not only the medical part of PCOS, which is so often the focus, but also the psychological part. PCOS is estimated to affect 6 to 17 million women aged 18 to 44 in the US only, where this current study has been conducted, and it's one of the most common causes of infertility. There's no single test to diagnose PCOS, and there's no cure, so that's why it's also hard to deal with it. This disorder is typically characterized by an excess production of the hormone testosterone, irregular ovulation, and cysts or fluid-filled sacs in the ovaries. How can we improve psychological and physical well-being in women suffering from PCOS? First of all, it's very important to acknowledge the challenges, both the psychological and the physical ones, because so often these women have been suffering in silence for many years. And maybe only when they wanted to have children, they actually went to evaluate what was going on with them. It's also important to speak with an expert to relieve tension and stress. An expert in that sense, meaning both someone who can talk to about your mental stress, but also the physical one. Changing habits can improve symptomatology too. Exercise has been proven to be a very helpful way to reduce the mental health burden and improve mental well-being. Diet and exercise in combination can boost both body and mind to be more in balance and also improve symptomatology. And seeking support for infertility, the earlier the better. And that doesn't only involve an infertility medical expert, but also psychological support during this process. Talk to other women in a similar position that also struggle with PCOS to get support from like-minded people that face similar challenges. I hope this has been helpful for you, and I will continue with part 2 very soon. Thank you for listening and have a great day.